This conference will now be recorded.
Welcome, everybody. So we are beginning basically the second portion of our class, and we're going to start with trauma, and we're going to start to get into EMS operations, mass casualty incidences, and then finish up the rest of the objectives for the EMT class. So for today's lecture, we're going to start off with utilizing chapter 27, which is our trauma overview. So when we're looking at trauma and trying to paint that picture, we're looking at the kinetics of trauma. So within the kinetics, we're looking at the mechanism of injury. So this is how that person was actually injured. So when we're documenting or we're arriving on scene, somebody was involved in a motor vehicle accident, the mechanism of injury would be that motor vehicle accident. With the kinetics, this is actually the science of analyzing the mechanisms of injury. So we're going to talk about mass times velocity, what's going on inside the body, and a little bit of pathophysiology as well. With kinetic energy, this is really the culprit behind that mechanism of injury, and then also, what's going on inside the body. So the definition of that kinetic energy is going to be the energy contained in a moving body. So we got to start reflecting upon, our 4th and 5th grade science lessons of Newton's laws, where an object in motion will stay in motion unless acted upon by an outside source. And that's really what we're looking at with that kinetics of trauma. A simple fall or a high-speed motor vehicle accident, think of that individual inside that vehicle where they're traveling at 70 miles an hour, they hit a immovable object. That person is going to continue traveling at 70 miles an hour until they actually collide with the end of that seatbelt. And then think of the organs as well, because those are still traveling at 70 miles per hour until they actually hit the front portion of that patient's body. So here, when we're breaking down the trauma kinetics, the mechanism of injury, and then also what's going on inside that patient's body, we can see the automobile on the right. We have front end damage. So that car, let's say it was traveling at 40 miles an hour and it collided with the silver car. So the individual who is driving, that mechanism of injury is going to be a motor vehicle accident by a front end impact. They're traveling at 40 miles an hour. So the injuries most likely we're going to see is going to be facial injuries, possibly chest injuries from that seatbelt. And then we could also see some C-spine injuries due to that neck traveling back and forth. Then in the exact same scene, we have highly different injuries that we could possibly see with the individuals in that silver car. So with that driver, we're going to see injuries located on the left side of the patient's body in comparison to the green car. And then with the mechanism of injury, we're still going to see C-spine injuries, but instead of going front and back, that patient's neck is going to go side to side. And then with gunshot wounds, stabbings, this is highly different when we're looking at the kinetics of trauma. So with a penetrating injury like this, we can see the entrance wound. We might be able to see the exit wound depending on the caliber of that bullet, but we really don't know what happened inside the body, especially when we don't have an exit wound, because we don't know how that bullet actually interrupted the different anatomy inside that patient's body. Same thing with stabbings. And then when we're looking at falls too, so when we're breaking down that kinetics, when an individual falls from a certain height, there's a lot of statistics out there that if they fall from 2 times the height of their stature, then their chance of morbidity or mortality is extremely high. We're also looking at this as far as what was the landing impact. So it looks like this individual is falling to a concrete floor in comparison to this person fall into a muddy area outside, and did that impact their fall at all? And then blast injuries always pose a extreme threat too, and there's actually a multitude of different kinetics when we're looking at this. So when we get into blast injuries, which is going to be in a couple of chapters, we're going to talk about the different levels of impact. So first we have that waveform from that initial blast. Then we have secondary injuries from rubble, gravel, rocks that actually impact the body, and then that person falling to the ground. So we actually have 3 impacts when we are looking at significant blast injuries. So when we're breaking down the trauma kinetics too, we're looking at mass and velocity. So with kinetic energy, we have 2 factors. We have the weight of that patient or weight of the car or vehicle that they're traveling in, and then also the velocity or the speed. So with kinetic energy, it's going to be mass times the velocity squared and then divided by 2. So when we look at the picture down here, we have a semi-truck and then we have a motorcycle. So imagine them trying to create the same amount of kinetic energy. So the semi could be traveling at 5 miles per hour and they're going to create a substantial amount of kinetic energy. Same thing with the motorcycle. That individual traveling at 70 miles per hour, that velocity is squared. So really velocity plays a larger role in comparison to mass. So when we're looking at acceleration and deceleration, so I mentioned this earlier with Newton's law, but the law of inertia again is that body at rest will remain at rest, or a body in motion will remain in motion unless acted upon by an outside force. So with acceleration and deceleration, the definition of acceleration is going to be the rate at which a body in motion increases its speed. So when we're traveling, we depress that accelerator in our car harder and harder, we're going to accelerate down that road. And then in comparison, when we have deceleration, it's that rate in which that body actually decreases its speed. So when we're looking at injuries, oftentimes the major concern that we have is deceleration. Is that person hitting the ground, and so all of their acceleration or all of their inertia is immediately stopped, or is it a gradual stop in which we would see a little bit less injury in comparison to that? So this paints a great picture too of what's going on inside the body. So anatomy, pathophysiology, our organs aren't, airtight or completely secured to the inside of our body. And this is a great example when we're actually looking at the anatomy of the brain. So the brain is going to be housed within the skull, and then it's cushioned by the cerebral spinal fluid. So when somebody gets into a head-on collision or a side impact, think of that small amount of space that brain is actually floating in that cerebral spinal fluid. So they get into a front-end collision, they compact that airbag deployment, and so they're moving forward. So we could see frontal injuries to the brain or that frontal lobe. And then once that deceleration happens and they go back, that's where we're going to see injuries to the back portion of that brain as well. And keep that in mind with all of our organs inside of our system. Our GI, our lungs, our heart, again, they are housed within different tissues of the body, different fluids, and so it's not completely compact. So when we're looking at impacts, and again, this is going to be a reflection upon our mechanism of injury, we have multiple different impacts. We could see vehicle collisions, could see body collisions, and then we also have organ collisions. So first off, when we're looking at vehicle collisions, this is always going to be a high index of severe injuries. And how we can base this is how fast this individual is traveling. Again, we're taking that mass times velocity squared divided by 2. And then also when we are using our detective skills, we're walking around that car and seeing how much damage was actually inflicted on that automobile. And then if that patient compartment area was intertwined with that injury as well. So a couple of different scenarios where we're always going to keep that high index of suspicion. If there's another death in that car based on that motor vehicle accident, an unresponsive patient, or a patient with an altered level of consciousness, or when we have that intrusion factor greater than 12 inches inside that occupancy site. That patient is ejected from that motor vehicle, and this would be a multi-system trauma incident as well. When we have frontal impact, the driver will continue to move forward at that same speed of that vehicle. I mentioned that earlier. So the different types of injuries that we could see, abdominal injuries, especially with how they're positioned inside that vehicle, whether they're actually using a safety restraint system with a lap belt and a shoulder belt, and then also whether that airbag was actually deployed. So luckily in cars nowadays, they're extremely safe. They have a lot of different airbag deployment systems. When we start looking at our older vehicles where we don't have those airbags, that steering wheel is very unforgiving. So we can see more chest injuries, broken ribs, perhaps flail chest segments, and even tension pneumothorax. And then we're always going to see face, head, and neck injuries, especially with that airbag deployment that comes at a very high rate of speed. And the airbag and the seatbelt always work synergistically with each other. So if that patient is unrestrained, that airbag can actually cause more damage, and then vice versa as well. So there we can see a great example in the event that that airbag didn't deploy and this individual is unrestrained. That motion or that energy is going to be traveling forward. This individual struck that steering wheel with their chest, and then as a result, we're going to see a tension pneumothorax where that lung was actually expelled out that patient's back. With rear end impacts, biggest concern that we have here is going to be that head and neck, because it's propelled backwards and then it's also propelled forwards. Very similar as far as other injuries that we're going to see with that front end collision. When we have lateral side impacts, this is that vehicle is going to be struck laterally, and this oftentimes is the most dangerous aspect, because if somebody gets hit from behind, there's a certain amount of distance with that trunk area. When we have a front end collision, we have that engine block that's really going to take a huge brunt of that. But where vehicles are more susceptible is going to be those side impacts. So we're going to see a multitude of different injuries. We're going to see head and neck injuries, because that C-spine, that head area is going to be pushed laterally, and that is very an uncommon motion for how our C-spine is actually developed. We're going to see chest and abdominal injuries. That patient is going to be rocked forward and backwards. That seat belt doesn't provide a great amount of resistance when we do have that side impact. And then we can also see some significant pelvis injuries too. And we're going to be talking about the amount of blood loss that we could potentially see with these different types of injuries in this next section. Next, we're looking at rotational or rollover crashes. Very unpredictable. You know, some individuals, they're unrestrained, they bounce around that car, and they walk out of that car with a minimal amount of injuries or just a small scratch. Other ones, they're going to be trauma alerts or dead on arrival. Oftentimes, we're going to see multi-system trauma, where the definition of multi-system trauma is 2 or more body systems that are actually affected. So we could see the skin system and the musculoskeletal system, the respiratory system, cardiovascular system, what have you. Next, a very common incident that we're going to respond to, not necessarily in the rural areas, but in the large metro areas like Minneapolis, St. Paul. This is a very common occurrence that they actually respond to. This is going to be the vehicle versus pedestrian collision. So when we're looking at the mechanism of injury and the multitude of different injuries that we could see, again, it's based on that kinetic energy. Were they struck by a semi-truck going 2 miles an hour, or were they struck by that motorcycle that was going 70 miles an hour? Size of the car versus size of the patient, and then it's also good to keep in mind what the age range of that patient is. So for adults, we're highly developed, and when we see danger coming at us, such as a vehicle versus pedestrian collision, that individual is going to turn away from that car. And so we're going to see injuries to the shoulder and the back, oftentimes with adults. Now with our pediatrics and our smaller children, oftentimes they will actually face that point of danger. So we're going to see front mechanism of injury and front injuries. And then with our restraint systems, again, our simple lap belts, which we don't see anymore with our new style of vehicles because it is a requirement that you have to have a lap belt and a shoulder belt in all new models. But we could see some pretty significant pelvis injuries and abdominal injuries if it is just a lap belt, depending on where that lap belt was positioned. So again, if that lap belt is positioned higher than what it's meant for, we're going to see some pretty significant abdominal injuries leading to GI issues. So when we're looking at our anatomy inside and we have those hollow organs, which are going to be specifically designed for our respiratory system and our GI system, we can see a lot of complications due to the fact that those hollow GI organs might be leaking different substances. And then with our solid organs, such as our liver, we can see an extreme amount of blood loss from something like this. When we have a lap and shoulder belt, again, this is a higher level of protection, but there is no protection for that C-spine injury. So it's always a good rule of thumb when we arrive on scene for something like this, that we should be taking C-spine precautions immediately. Airbags, again, high level of force. We're going to see those skin tears, those abrasions from that. And then also with those airbags, they do deploy powder substance with them. Don't get concerned or overly concerned about that powder substance that's going to be located inside that car. And then we also have car seats. So car seats, when they're properly installed, do a great job as far as minimizing injuries for our pediatrics and our infant patients, but they can cause quite a bit of hindrance when they are not installed properly. And then it makes it very difficult for us to A, assess those injuries, and then B, really maintain a good, proper airway management system. So some pretty common abrasions, bruises, contusions that we're going to see with this individual. Can see that he was located in the passenger side of that vehicle because that lap belt is coming over his right shoulder, and it looks like that lap belt was actually positioned a little bit higher than what it should have been. So we can see the kinetic energy, we can see that mechanism of injury. Big concerns here is going to be that upper two quadrants of that abdomen because there is significant force there. And then also keep in mind our musculoskeletal system doesn't protect our GI system very well. And we can see on that patient's right side that bruising in that upper right quadrant, that is exactly where our liver is. And again, it's a very large solid organ, very vasculature, so we could see a lot of different blood loss. Here we have a pediatric patient, and again, that lap belt was positioned higher than what it should have been. That lap belt should be around the pelvic wings, so it's going to provide a little bit more stability. And when we're looking at the lower quadrants, then we can see some issues with the large, small intestine as well. This is a classic example of a front end collision where we have abrasions from that airbag deployment. Now, this is exactly what it's meant to do. This is a very common occurrence when we do have a front end collision with that airbag deployment. And then this is a good example of proper car seat installation and then also proper car seat positioning. So you can see the individual who is most forward towards us, that proper restraint system. And so it's still protecting that C-spine, even though we're still going to get some injuries associated with that. But without that tether device for that car seat, we can see how far that C-spine was actually bent during that front end collision. Next, we're going to look at motorcycle accidents. This is a high rate of mortality, especially if they're traveling 40 miles an hour or greater, because that individual is then thrown from that motorcycle. And again, they're still traveling at 40 miles an hour. So when they are involved in a front end collision, common injuries that we're going to see is everything in the upper torso. And oftentimes we'll see bilateral femur fractures as well, because that patient is propelled upwards and those femurs actually collide with those handlebars. Same thing when we're looking at four-wheeler accidents. So when an individual actually takes that motorcycle class, they are often taught how to properly lay down the bike, and that's where we're going to see a least amount of injury when they're actually able to evade that impact site. Where we see is a heavy amount of abrasions, where it actually disrupts the skin system, where we can see things more chronic issues compared to acute issues such as hypothermic patients where you're losing that integrity of that skin. Could also see infection as well build up. Next, with falls, biggest impact area is what side of the body or side impact that they actually fell on. So feet first falls with trauma kinetics, all of that energy is going to be traveling in a straight line until it meets a curve. So if somebody's knees are locked and their ankles are locked and they fall from a position and land on their feet, all of that energy is going to travel upwards until it actually meets the pelvic area. And that's where we're going to see the blunt of that force. Now, if somebody's knees are bent or their ankles are bent, that's where we're going to see those injuries to the knees or the ankles. So falls, this is a very high morbidity statistic when we're looking at it in the United States. So 540,000 falls requiring hospital care in the United States of America, which is crazy to think of. And then when we look at these, 25,000 fatalities happen from slips and falls. So that's significant. Very common occurrence that we're going to go to as far as EMS providers, and keep these statistics in mind. Where you get paged out for an individual who fell from a standing position and you're thinking that it's not a big deal because it's a very small height. But again, look at these numbers and keep them in mind when you do respond to those calls. Then with low velocity injuries, so we're looking at low speed. So this could be from a knife or other type of penetrating injuries. Always pay attention to where that stabbing actually occurred inside that patient's body. So think of our most vital organs versus our non-vital organs. So if somebody's stabbed in the chest, that's going to be more significant than the bottom of the leg or the bottom of the foot. The length of the object, and then also how sharp that object actually is too, is a good indicator of what's going on inside that patient's body. So again, this is a great example of identifying where this object actually is. This is exactly where our heart is. When we have a penetrating object like this, it's always best practice to never remove it. The only time that we actually remove that object is if it's interfering with the airway and we can see both sides of it, or if that patient's in cardiac arrest and we need to do CPR on this individual, then we can go ahead and remove it and start doing chest compressions. Now, big culprit behind this is an example with Steve Irwin, the alligator guy, where he was actually stabbed in the chest, very similar to this with that stingray tail. Now, everything was compacted around that penetrating injury, but once he removed it, he actually tore his aorta when he did that and immediately went into cardiac arrest. So here, good example of that length of that object. So you can see this is a very long kitchen knife. You know, how far did it actually penetrate inside that area where it could have affected the lungs or the cardiovascular system. Then keep in mind too, our kidneys are very retro in comparison to the rest of our body, and they house a lot of toxins and a lot of waste material too. in order for us to get rid of that. When we're looking at medium and high velocity injuries, this is generally with bullets or some type of object that actually throws that. So look at the trajectory and then look at the caliber as well when we're dealing with this, and then try and imagine where that bullet actually went through that patient's body. Now, if we have a entrance and an exit wound, we can kind of justify exactly where that bullet went through. But if we have an entrance wound and we don't have an exit wound, then we have no idea what type of organs that it actually disrupted at that point. And there is a lot of different definitions as far as bullet wounds, entrance and exit wounds. So I'll give you just a couple of seconds to read through those. And then oftentimes these types of definitions are going to show up on your quizzes and your tests and even the National Registry exam. So here, just a couple of pictures of those definitions, and we can see that drag of that bullet, where depending on the velocity of it, we're going to see that fall and also see a less of an impact. I'm not even going to try and pretend to know these different bullets at all. I'm not a hunter. But here's the big thing too, when we're looking at the inside of that injury site. So how much tissue damage is actually done when that bullet does enter that cavity and what it can actually do. So here, oops, all those different injuries that we could see with those gunshots. With chest injuries, this is where we want to be high index of suspicion and immediately start treating those life-threatening injuries, such as using a chest seal or an occlusive dressing in order to stop the possibility of a tension pneumothorax. And then we also talked about abdominal injuries, whether they're air-filled organs or fluid-filled organs, such as our heavy vascular organs that are comprised of mostly blood. And then I mentioned this earlier with our blast injuries. Again, there are 3 different phases. Our primary phase, pressure wave of the blast. Secondary phase, our flying debris. And then our tertiary phase is when we actually have contact with the ground from that individual actually floating through the air. So with that primary phase, we can see a lot of organs that are considered hollow to be compromised based on just that sound wave. And then with our secondary injuries, we're going to see more musculoskeletal, abrasions, contusions, and then tertiary, again, we're going to see more musculoskeletal injuries. With our multi-system trauma patient, this is a great statistic. 90% of the trauma patients have a simple or a single injury that involves just one body system. Now that other 10%, we're going to see multi-system trauma where we have multiple injuries and involve more than one body system. When we do have that multi-system trauma patient, so for example, our motorcycle accident, this is a very high incident of that morbidity or that mortality rate. Don't get distracted by distracting injuries when we are dealing with our multi-system trauma patients. You know, we arrive on scene and somebody's got a horribly fractured ankle and all of our attention is focused on that ankle. In the meantime, this individual is not breathing. So again, I'm going to punt it in the airway, breathing, circulation when we are dealing with any type of incident like this, and all of our medical patients as well. So the book and a lot of EMS resources are going to reflect upon the golden period or the golden hour. And that golden period is getting that injured individual from the time of the incident or the accident in 60 minutes, having them arrive in the emergency room. Now, this is much easier said than done, especially when we're dealing with the rural area Even when we're dealing with, a place like Proctor or Hermantown, somebody's out hunting, it can be a substantial amount of time to try and get to that individual and then get them out. So with this is where we is more susceptible or more acceptable as far as our line of work and where we are geographically in the country, and that's that platinum 10 minutes. When we arrive on scene, we want to try and have that patient loaded up and transporting within 10 minutes. Now, obviously, this all depends upon what our role is. If we're an EMT basic service that has transport capabilities, then yes, this platinum 10 minutes should be a goal of ours. Now, if we are a non-transport service, then we don't really have much to do with that platinum 10 minutes, but we can help facilitate that. So that's why it's such a great thing, when I worked for Gold Cross and Lake County Ambulance, is when I arrived on scene and the first responders had the airway, breathing, circulation taken care of, and that patient was already C-colored and backboarded. So I could immediately get them into the back of the ambulance and start transporting, and I could take care of some more advanced level procedures. So our big key to success is in that determination whether this patient is severely injured or not injured. It's kind of like our medical emergencies. When we arrive on scene, it's an immediate determination whether this patient is sick or not sick. Within the trauma system, we have a multitude of different levels of trauma hospitals. So in the Duluth Superior area, we have one level 1 trauma center, and that's going to be Essentia Health. So with that designation, they can manage all types of trauma 24 hours a day, 7 days a week. They're not allowed to go on trauma divert at all. With our level 2 trauma centers, these are going to be our St. Luke's and then also our St. Mary's Superior. So these can manage most trauma with surgical capabilities, stabilize that patient, and then be able to transfer them over to that level 1 trauma designation. With our level 3 community trauma centers, this is going to be our Cloquet Hospital. This is going to be our Lakeview Hospital out of Two Harbors, and then also our Sandstone hospitals. And then with our level 4 trauma facilities, these are very small community-based hospitals in remote areas. So think of our Hoyt Lakes hospitals. So here we can see that massive designation in between level 1, level 2, and level 3 trauma centers. Not very many level 1 trauma centers in the state of Minnesota or in the state of Wisconsin. There's really not a huge difference between our level 1 and level 2. Level 1 has a lot of different research components and educational components, but really the capabilities between our level 1 and level 2 are similar. It's just the amount of resources that we really see. Now, special considerations when we're dealing with trauma is always scene safety, because the bulk of our traumatic incidences that we respond to oftentimes involve motor vehicle accidents, and this is where we see a lot of EMS providers, law enforcement officers get themselves hurt and or killed because people are not very good at driving, especially when they see the lights and they hear the sirens and they want to see what's actually going on. Airway management is always a very difficult task, especially if you have entrapment inside that vehicle where you have to manipulate, suction out that airway, and provide assisted ventilations when that patient might be upside down or still trapped and unresponsive inside that scene. Trying to identify and then stop that significant bleeding. Again, when you're in those goofy circumstances, we're going to talk about stopping the bleed and the different steps that we should go through. But when we're dealing with special considerations like this, we might straight go to a tourniquet. Our trauma assessment, get your hands on your patients, especially when we're practicing, because we're going to practice how we play. Utilizing that backboard as a splint. So remember, we can utilize that backboard as a full body splint. So I mentioned earlier with that distracting injury where we have a severe trauma patient, they have a pretty gross ankle fracture. I'm not going to worry about that on scene. I'm going to utilize that backboard as a full body splint, and I'm going to say that's good enough for that ankle injury so that I can focus more on the ABCs. All right, that leads us into the introduction of that trauma. So next we're going to be talking about bleeding and shock. And then also I'm going to be sending you guys a PowerPoint based on trauma kinetics. And then there's also a very good YouTube video on burns that was done by a guy I went to paramedic school with. All right, thanks everybody.